to select where they're logging into. Are they logging into their own practice, or they're logging into the hospital? Because the hospital is using the same user interface, and there's a full transparency of the patient's record. So if they have created some records in their office, and the offices next door created records, the hospital should have complete transparency to that. And when the patient is there, they should be able to see it. And that's part of what we're providing, that complete integration between the hospital and multiple other sources of data. And so this picture is actually when the doctor logged in and they're in the hospital, but they have other choices. In this particular case, they're at OMC, but they can be selecting a different setting or a different facility to be in. They can be, and we now connect to multiple hospitals and multiple practices. And so if they are moonlighting at some practice, they can see that as well and just simply select it from here. Clicking on any one of these patients, they will be taken to the patient document screen that will give them all the data that they want. And here we can actually ask them to say, look, this patient has inpatient, outpatient, and emergency room, ED records. So they can select or deselect any one of those. As far as your source's location, we always tell them where that record is coming from, so that they know that this the latest stuff is coming from the practice, and the stuff before that came from a hospital, etc. And now we can even merge multiple practices together if they want to work together. If the patient allows for the record to be shared, we'll do electronic sharing, so they don't have to do the faxing and any of that. This would be a list of their commonly used medications. As soon as they select the patient right there at the top, sub-second interval, all these things light up on their list to tell them which things are contraindicated for which patient. So the allergy is right away marked. You can see now, oh yeah, she's got the allergy right there. So all of this information is constantly presented to the patient, but it's more than that. If you've selected something that the patient is allergic to, you can actually see the alternatives, because once you select it here, you'll see the alternatives displayed for you right there, and you can select them based on the price. So this is just a very small portion of the sophistication that we can offer to our users.